Drug-induced liver injury is an uncommon but clinically important form of liver disease. Its frequency driven by how often drugs are taken and the likelihood that they cause injury. The multiple types and phenotypes of injury vary according to the agent, presenting a diagnostic challenge. Recognizing phenotypes of drug-induced liver injury is helpful in establishing the diagnosis, identifying the responsible agent, and providing insights into pathogenesis. A better understanding of the pathogenesis of drug-induced liver injury should allow for better diagnostics and ultimately improved approaches to prevention and treatment. The information presented in this video should not be used for diagnosing or treating a health problem. Consult your healthcare provider before making any changes to your health plan. Remember to subscribe to this channel so you can be notified of more pharmacy and medicine-related videos. Drug-induced liver injury, or DILI, is a condition that occurs when a drug or supplement causes damage to the liver. DILI can affect the liver's ability to perform its vital functions, such as filtering toxins, producing bile, and metabolizing nutrients. DILI can also lead to serious complications such as liver failure, bleeding, infection, and cancer. Its incidence is estimated to be between 14 to 19 cases per 100,000 persons, with jaundice accompanying 30% of these cases. Drug-induced liver injury is responsible for 3 to 5% of hospital admissions for jaundice and is the most frequent cause of acute liver failure in most Western countries, accounting for more than half of cases. Advances have been made in our understanding of viral, autoimmune, and genetic liver diseases, as well as approaches to their prevention and treatment, but progress on these fronts has been modest in the case of drug-induced liver injury. This illustration contains the proposed mechanism of DILI. Starting at the bottom left of the diagram, which involves drug metabolism through a cytochrome P450 mechanism where reactive metabolites are created. This can lead to hepatocyte damage or liver cell damage, then activation of innate immune cells. For example, interferon, which is indicated by IF, or interleukin cells, which is indicated by IL. Then you have NK, natural killer cells or natural killer T cells. And after the creation or activation of these innate immune cells, there is production of tissue damaging and also tissue protective mechanisms. The diagnosis of drug-induced liver injury is particularly challenging since it is based largely on exclusion of other causes. The timing of the onset of injury after the implicated agent has been started, in other words, the latency, resolution after the agent is stopped, meaning the de-challenge or of withdrawing the product, or reoccurrence or recurrence on re-exposure or the re-challenge of the product. Knowledge of the agent's potential for hepatotoxicity and clinical features are the major diagnostic elements. With few exceptions, there are no specific diagnostic markers for drug-induced liver injury, and special tests, for example, liver biopsy imaging, serologic markers, are helpful mostly in ruling out other causes of liver injury. The diagnosis of DILI is primarily, again, based on medical history, physical examination of the patient, lab tests such as blood tests, urine tests, image testing, and drug history and exposure assessment. Risk factors for DILI include taking multiple medications or supplements at the same time, having a pre-existing liver condition, having a genetic predisposition to liver damage, taking high doses or prolonged use of certain drugs, or taking drugs that interact with each other. Symptoms of DILI may include abnormal levels of liver enzymes in the blood, jaundice, dark urine, nausea and vomiting, loss of appetite, fatigue and weakness, or abdominal pain and swelling. The table in this slide talks about the classifications of drug-induced liver injury. DILI is typically classified as either direct or idiosyncratic, but indirect injury is emerging as a third type. Direct hepatotoxicity is caused by agents that are intrinsically toxic to the liver. The injury is common, predictable, dose-dependent, and reproducible in animal models. The latency period is typically short, usually with an onset within 1 to 5 days after high therapeutic or supratherapeutic doses, as in the case of an intentional or accidental overdose. Idiosyncratic hepatotoxicity is caused by agents that have little or no intrinsic toxicity and that cause liver injury only in rare cases, typically after 1 in 2,000 to 1 in 100,000 patient exposures. The injury is unpredictable, not dose-dependent, and not reproducible in animal models. Idiosyncratic liver injury is categorized as hepatocellular, cholestatic, or both on the basis of the R ratio calculated by dividing the alanine aminotransferase level by the ALK phosphatase level, which are liver enzymes, from the time of initial presentation with both values expressed as multiples of the upper limit of the normal range. Hepatocellular injury is defined as an R value of more than 5, cholestatic injury is a value of less than 2, and mixed injury as a value of between 2 to 5. Indirect hepatotoxicity is caused by the action of the drug, for example, what it does, rather than by its toxic or idiosyncratic properties. Indirect injury can represent induction of a new liver condition or an exacerbation of a pre-existing condition, such as induction of immune-mediated hepatitis or worsening of hepatitis B or C or fatty liver disease. In this table, you'll also see a list of commonly implicated agents for each type of hepatotoxicity and the proposed cause associated with these hepatotoxicities. Now let's talk a little bit more about some of the medications that can cause DILI. The table here lists most frequent causes of idiosyncratic prescription DILI. So these are top 13 products that are known to cause idiosyncratic DILI. The topmost being amoxicillin clavulanate, which is trade name Augmentin, which is an antibiotic, followed by isoniazid, nitrofurantoin, TMPS, MZ, minocycline, amongst others. You can see a trend here that most of the products listed on this list are anti-infective products. So that's something that may have something to do with how idiosyncratic DILI may be occurring. For additional references, you can refer to two additional sites. First being LiverTox, which is the website sponsored by the NIH on hepatotoxicity. It has descriptions of more than 1,200 agents, both prescription and over-the-counter medications, herbal products, nutritional supplements, metals, and toxins, along with their potential to cause liver injury. Among the 971 prescription drugs described, 447, or 46%, have been implicated in causing liver injury in at least one published case report. Another source is the FDA DILI rank site. The DILI rank dataset consists of over 1,000 FDA-approved products that are divided into 4 classes according to their potential for causing drug-induced liver injury. The DILI classification is derived from analyzing the hepatotoxic descriptions presented in the FDA-approved drug labeling documents and assessing causality evidences in literature. Specifically, the largest publicly available annotated DILI dataset contains 3 groups: most, less, or no DILI concern, with confirmed causal evidence linking a drug to liver injury, and 1 additional group, which is listed as ambiguous, with causality undetermined. Finally, let's discuss treatment and prognosis. Some of the possible treatments for DILI include stopping or reducing the use of the offending drug or supplement, taking supportive care measures such as fluids, electrolytes, vitamins, antioxidants, taking specific medications to protect or restore the liver function, such as N-acetylcysteine. Specifically, it's used for acetaminophen-induced injury, corticosteroid use for autoimmune hepatitis, or ursodeoxycholic acid for Wilson's disease. Finally, in severe cases, a patient may undergo liver transplantation. The prognosis of DILI varies depending on the extent and duration of liver damage, the response to treatment and management, and the presence of complications or comorbidities. Some patients may never fully recover from DILI with proper treatment and follow-up. Others may have permanent or recurrent liver damage that requires long-term monitoring and care. Some patients may even die from DILI or its complications. DILI is a serious condition that requires prompt recognition and treatment. If you suspect that you have DILI or have been exposed to a potentially hepatotoxic drug or supplement, you should seek medical attention immediately. You should also inform your doctor about all the medications and supplements that you are taking before starting any new treatment. You should also avoid taking more than one medication or supplement at a time without consulting your doctor. You should also read the labels carefully and follow the directions for use of any medication or supplement you are taking. I hope you found this video educational and useful. Please remember to like and share. Thank you.